Coronavirus misinformation can seemingly spread like wildfire online, but new research finds there are ways to combat inaccurate information. Sara Fischer is an Axios media reporter, and she joins us now from her home to talk about this. So, Sara, explain what researchers have discovered and walk us through what we've seen the suggested action in practice should look like.
Yes, thank you so much for having me on. So essentially, we all thought after the 2016 election, when there was a lot of misinformation at that time, that we should label things as being true or false, and that would help the problem. But what researchers have found over the past 4 years is that actually can make it worse. When you use binary labels like true or false, you might incentivize people to click something labeled false just because they're curious to see what it is. It also politicizes the problem. Oftentimes when you're going out and labeling something true or false, because of the hyper-political environment, people take issue with it, they feel offended, you're calling my perspective wrong. So what researchers and academics say is better to do is actually just to provide a lot of supplementary information that's factual alongside the misinformation, allow people to get a little bit more context, and that way they can get exposure to the truth without you negating something and calling it false that might offend someone or incentivize them to click it further.
Sara, I found your article so interesting because it sort of explains this in a very, very scientific way based on the people who just focus on misinformation and how to combat it. I thought the point about misinformation reaching sort of 10% penetration into a population, that you almost sort of, before you decide to combat it, it needs to kind of be exposed to a certain amount of people, but not too many people in order to have an impact. But, you know, a lot of people will say, look, this is about freedom of speech. It's about a conversation. The government doesn't always tell us everything, so we should be allowed to kind of research. Can we talk about how damaging incorrect information can be and why the WHO is so concerned?
Absolutely. And you make a great point about the 10% theory, which is essentially don't waste your resources debunking something unless it's hit a threshold where it's actually a problem. And part of that research also said, don't focus on misinformation that's not really dangerous. I mean, there are a lot of rumors out there. How did the disease spread? But that's not what's actually dangerous right now. What's dangerous is misinformation about cures that could actually make it much worse and be even worse for your health. So it's prioritizing what to go after is a huge issue here. In terms of why misinformation is so damaging, we call what we're in right now an infodemic. You see that graphic on the screen. An infodemic is when you have so much misinformation that it's actually making the problem a lot worse. What we found with COVID is that there was so much misinformation about how you prepare for it that it made the problem worse. We were going out and saying, this is spreading like wildfire. And so in the beginning of the epidemic, people were buying up masks and gloves and personal protection equipment that we really needed to go to the healthcare workers, which was making the problem even worse. And so I think the big solution, the big takeaway from this article is you need authoritative people, government officials, healthcare officials, to be giving people context, to be using scientific tools to combat misinformation, as opposed to just labeling something false.
You know, as I read your piece, Sara, and we've talked often on the air and off the air about this stuff. Just sort of my caveman question, my caveman theory about all this is, does a lot of it have to do with how we receive information in 2020? And I know it sounds simplistic, but the fact that, there have been multiple articles and even perhaps books that have been written about the fact that whilst we have the entire world at our fingertips, either through our computers or through our devices because of the internet, you would think that that would make people smarter. You would think that that would provide people more information that is credible and transparent. But in fact, the reverse and the opposite has been true. As the internet has become all encompassing in our lives, we've actually become, for lack of a better word, less smart because we are unable to vet so much of the information that is coming to us. And I know it sounds kind of simplistic to say, perhaps people should still make sure that they have a good set of encyclopedias at home. But really, it has to do with the way that we receive information. So short of, completely disconnecting from the internet, what can people do to ensure that they are not getting misinformation that is suspect or biased?
Such a good question. Well, the first part of this is that healthcare officials need to be pre-bunking or exposing people to correct information long before we have a problem in order to prepare people for when we do have a problem. So an example of that is when this pandemic first broke out, health officials told everyone, you need to wash your hands. Notice, Vlad and Emery, there wasn't a lot of misinformation about whether washing your hands actually works. And the reason is we've educated our population for decades that hand washing helps cure the common cold. But what we did have a lot of misinformation around was vitamin C. We have done a bad job as a society of educating people about the fact that vitamin C does not cure a cold. It can boost your immune system, but it's not a cure. And so we saw at the beginning of this outbreak, there was so much misinformation about go buy vitamin C, when in reality, that wasn't something that we needed to do. So first and foremost, health officials need to pre-educate people. Secondly, if you're a person who needs to figure out where am I getting my information, is this misinformation, is it not? The thing I would always say is go to credible sources where people use editors to vet information. A credible source may not be social media. Those are not news companies. Try to get your information from vetted news companies, big broadcast networks, of course, but then also newspapers. Your local newspaper is a great resource as well.
And just to add sort of one more thing, though, the research that you talk about has a lot to do with, credible sources and authority figures. But we have an issue here in which we have an authority figure, the President of the United States, who has delivered incorrect or unverified information. And doesn't that kind of throw a monkey wrench in everything?
Yes, and this is why it's such an important role that Dr. Anthony Fauci and Dr. Deborah Birx are playing right now, is that we do have a president who's been spewing misinformation, and so they are trying to kind of almost play cleanup. And you'll notice they're going everywhere. I mean, I was really impressed that Dr. Fauci was on the virtual NFL draft, spreading proactively correct information about social distancing and the virus. What they're trying to do is they're just trying to be everywhere so that if authoritative figures like the president were to spew misinformation, they can go out and discount it. And also notice part of the research we did is you need, as an authoritative health figure, to go to venues where people are exposed routinely to misinformation. So if you're Dr. Anthony Fauci, going on a network like CBS, where there doesn't tend to be a lot of misinformation, that actually doesn't help you so much. That audience is not predisposed and exposed to misinformation. What they recommend someone like Dr. Fauci do is go to places like opinion shows on Fox News where there is misinformation being spewed, speak to that audience and try to educate them there, because they're the ones that were exposed to misinformation in the first place.
Really, really great information, great reporting, Sara Fischer from Axios. As always, we appreciate it. Thank you very much. Have a wonderful weekend.
Thank you, you too.